So welcome to Clean Air Day 2024. Um, and really pleased to be part of this presentation hosted by myself, Dr. Norma Gregory. I am director of a social enterprise called Nottingham News Centre, which is based in the East Midlands in Nottinghamshire in the UK. We welcome any listeners that will be coming in, hopefully joining us throughout this session, which is UK time from 1 o'clock until 2:30. We've got two special guests with us today, two experts. I consider them as experts more than me in this field, to share with us some of their knowledge, their products and skills, and some of the work, the amazing work that they do in the UK and probably around the world as well. So they will join us to share some of their lived experience working in this environmental education sector, and sharing some of the kind of ideas that we can all do to help improve the environment. So yeah, big thanks to our sponsors today, which are Heritage Compass. They support small businesses in the UK, and I've worked with them over a number of years. They've helped the work I've done promoting heritage, industrial heritage, and how we can work better to raise awareness around the heritage that's all around us. To Medicare, we have Graham Thomas, the CEO of Medicare, providing quality air cleaning and air filtering products, which he will talk about shortly. And Malcolm White, who's from Global Action Plan, an expert in clean air education. So he will share some of his knowledge. And the Heritage Fund, who have supported Heritage Compass. So the overview of today. So the main question that we're looking at is what is Clean Air Day and what happens on that day. So Clean Air Day is the UK's largest air pollution campaign, engaging thousands of people, hundreds of thousands of people, in events and across the UK, through media, social media and television and so forth, radio. It is coordinated by Global Action Plan, and brings together communities, businesses, education and health sector professionals to improve public understanding around air quality and pollution and the effects it has on everybody's health, and also explaining some of the easy things we can all do to tackle air pollution, helping to protect our health and environment in the UK and across the world. So it's a massive, I think it's one of the most important health campaigns that needs to be bigger than it is and more valued than it is. So obviously we've got the election coming up shortly in the UK. So this, I feel, is one of the major campaigns that we should be all pushing to see some major change in the next government, whoever that will be. So just a very short kind of backstory of my interest in clean air education. Firstly, I am asthmatic. I'm not, my kind of symptoms are, I don't kind of suffer with asthma every single day, but it used to be quite bad when I lived in London. Probably I left London about 16 years ago. I lived in London for 19 years, and I never had asthma as a child, but I noticed when I lived in London, and going to work in central London every day, pretty much, I developed asthma, and I have to put it down to some of the air quality and the traffic that I was facing on a daily basis. So now I live in Nottinghamshire. I still have my asthma pump, but I don't actually use it very often. But I always keep it on me just in case I need it. But I only get it at the end of a flu or something now. So, but what I have noticed is that yeah, air quality for me is different in Nottinghamshire. It's not, I wouldn't say it's perfect at all, but I know that I am less of an asthmatic. I do go walking a lot more. I do spend time in the countryside a bit more, and I live just there are fields about half a mile down from where I live. So I do know there is a kind of a difference in the air that I'm breathing just by my location. I also do a lot of work. I've done a lot of, nearly 15 years work research into mining history and the experience of former miners, particularly miners from the African Caribbean community, which was very unknown until I started looking into it, and kind of collecting data and collecting images and speaking, doing a lot of oral history, interviewing former miners about their lived experience, working underground, working in very harsh, dirty, dusty, moldy conditions for many, many years. And some of their stories around their health. I've been to many funerals of miners who've passed away over the course of my research over the years. I've been to many funerals, and seen the deterioration of miners, their lung conditions, their complaints to me, telling me about their breathing difficulties. I can't solely say that they're 100% from their time as miners, but we have to be realistic and be honest about their conditions that many of them are facing. So that's really one of the main reasons why I'm so interested in clean air education, in that I've actually lived experience myself from experiencing poor air quality, and also the experience of former miners who've told me about their poor health conditions and treatment that they desperately need to improve their lung capacity and dust that's in their lungs. So sorry about the picture quality. I just wanted to put these in some of the symptoms of asthma that I suffer, and many other millions of asthma sufferers, and some of the causes. So pollution, smoking. I mean, when I was younger, you could smoke. People could smoke on the bus, and you didn't have a choice around what the air you were breathing. So luckily now, there's no smoking on buses. But when I was younger, there was smoking on buses. Bacteria and viruses, pet hair, fluff and stuff that's in the carpet, chemicals and dust. So they're just some of the causes of asthma. And yeah, the picture on the left is just what happens to the kind of tubes inside your body when asthma happens. It's basically just like a tightening of the airways, which is fatal, can be fatal. So it's really, really serious. Clean air is really serious for asthma sufferers and other people with medical conditions. This was an oxygen detector that's a miner kindly donated to the Black Miners Museum, which I've set up since doing all my research into miners' experiences. So this machine was used to detect some of the levels of oxygen that was in the air, because underground, 300-400 meters underground, fresh air was very limited. So they used certain gadgets that came in the 70s and 80s. Before then, there was very little gadgets that they used. I do have a miner's lamp. I'm not sure, hopefully you can see that, but that's what they use to again detect methane gas in the air, and canary birds. If a canary bird passed out literally underground, it would be a sign that there was poor air, really poor air, and high levels of methane gas as well. So that's what the kind of things they use. And this was another methane gas detector. So we've got these objects in our museum now, just to use them to explain to people what was used, the things that miners used to detect poor air. I just wanted to very quickly try and share this video. It's only a couple of minutes long, with some of the miners talking about their experiences underground. Hopefully you can see this.
A group of East Midlands miners, their faces blackened by coal dust, but among their number, an actual black face too. It's only very recently that the hidden story of Britain's black mine workers has come to the surface.
Hello, yeah, it's been a while,
Reunited, two former miners from Nottinghamshire.
I guess we're walking down memory lane.
We've brought Gary Mitchell and Ken Bailey to Bilsthorpe Heritage Museum for a bit of nostalgia.
Let's walk in here.
Oh my Lord.
Yeah.
Straight away, the first thing caught my eye was the lamp.
I used to have one of them.
Encouraged by his father, Ken came to the UK from Jamaica in 1961. A young man of 22, he'd heard there was good money to be made down the mines. He'd go on to have 28 years in the industry. His first job was at Woollerton Colliery in Nottingham.
Because I'm the first black chap to work at that mine. They was quite surprised to see me in there. Some people were try to be nice, and some really come from what is, because it's a all white mine.
Ah, there's that canary. If it stays alive, you know you're all right. If it keel over, you best get out quick.
Gary's father was a miner before him, having emigrated from Jamaica in the 1950s. Gary worked at Gedling Colliery, a multinational mine nicknamed the Pit of Nations. At its height, around a quarter of the workforce was black, with a camaraderie at the coalface celebrated in this union banner.
When you go down there, colour didn't really come into play because we were all black, covered in soot. It's a dangerous environment. So we had to watch each other's back. And that kind of bound us together. It's like one family down there.
While it may have been one big family underground, above the surface, racial harmony was sometimes put to the test. In 1958, a race riot erupted in Nottingham. The local paper reported several people being taken to hospital.
Once you come up and you go in your shower and you wash off, it's like the atmosphere change. Like if we go in the canteen, you get the white folks sitting together and the black folks sitting together, having a meal or whatever. And it was strange that.
So this is somewhere you bring miners to
Yes,
reflect
it
and
is, yeah.
The site of Gedling Colliery is now a country park. A few of the pit's roof supports a reminder of what was here before. I've come here with local historian Norma Gregory. She spent years researching the untold stories behind Britain's black miners.
the Windrush generation. How many actually went into the mining industry? Do we know? Do we have any figures?
We won't be able to really know the exact number. There were many thousands. They never really kept numbers of their workforce. Colliery owners didn't, but we have a good sense that there were many and that they were there. That's the most important thing. They are part of the story and part of the history.
A lot of these museums, I'd like to see a few black pictures up because we did exist, and I believe they need to do a bit more than that to let folks know that black miners did contribute a lot towards the mining industry.
Bye-bye, guy.
Right, you bring back memories.
Yeah.
Between them, Ken and Gary clocked up nearly 4 decades in this industry, 2 of the thousands of black miners who helped Britain dig for black gold.
God bless. Thank you.
Right, so that video was we made that last year for Windrush 75. It was 75 years of the Windrush generation in the UK. So they were just 2 of the miners who have done. They've been great. I've known them for years, and yeah, they've just shared some of their experiences. So this slide, I just wanted to hope you can see the top. So comparisons of some of the injuries that miners experience, and some of the things in comparison with soldiers on the front line in World War I, World War II, and miners who worked in the UK. Obviously, there's no more mining in the UK. That finished 2015, but there are still miners working all across the world. I met miners in Kenya. I went to Kenya about a year ago. I interviewed some of the miners there. There's women miners in Kenya, South Africa, Colombia, South America. There's mining all over the world, so it's something that is still real. So just if you just note down, just explosions, there would have been dust, gas poisoning the soldiers, war soldiers faced, and miners on the other side also faced dust, explosions, mold, poisonous gases. So just in comparison, I just thought it was interesting that just some of the injuries and some of the experience of working soldiers and working miners, that it was actually quite close, but obviously different contexts. This slide just to reinforce that it's everybody's responsibility and duty to support change regarding air quality. I've learnt about it by speaking to people. I wasn't taught this at school. I wasn't taught, you know, it's only been recently that I've kind of realizing some of the realities, and it was brought to me by the miners' stories. So I've just spent years doing oral history, interviewing, helping to make new educational products and artwork, such as helping doing the research for this mosaic that is now at Gedling Colliery in Nottinghamshire.
Well, Gedling Colliery was known as an international mine. We had people from the West Indies, different parts of the West Indies, Dominica, where I come from, Commonwealth of Dominica. Then we had Jamaicans, we had people from Trinidad, another guy from St. Kitts, another guy from Montserrat, and it was known as international mines. We also had some chaps from South America, because he was a political chap and the government was after him, and he came and the mine, the union was very strong.
And Eastern European as well, I believe, yeah.
And the good thing about working in the mines, it's hard, but it was togetherness. The most important thing is you care for each other, so you do the job right. Because if you don't do it right, and somebody get hurt, he's got a family, he's got children, and you carry this burden. So it was a dangerous job. We accept that. And the responsibility is on us to do it right. So the most important thing is you have shift work. So when you
So I'll just stop there. Johnson Baptiste, he was a deputy in the mine, and he saw a lot of accidents underground and helped people who were injured as well. So he was just sharing some of his experience as a miner. So all this comes under the Equality Act 2010, a key UK law that gives protected rights to all people, but particularly people with age, disability, gender reassignment, married people, pregnant women, and people of different races, religion, sexual orientation, and gender sex. So that's the law where we all have a duty to ensure everybody has fair treatment and good health. That should be also one of the protected rights in this Equality Act, I believe. Just speed up a little bit now. So this is just a picture of some of the miners. I mean, I would say 2/3 of this picture was taken 2018. We did a reunion and it was on Channel 4 News. I got them all together. It was the first time they'd been together for years. They hadn't seen each other. These miners worked at all different mines across Yorkshire and Nottinghamshire. And a lot of them have passed away since this picture was 2018. Because of ill health and poor breathing and other ailments. So the Nottingham News Centre, our educational mission is to help people make better choices and to recognise positive contributions to society and health and well-being. Our motto is to dig deeper and do better. And just very quickly, some of the work we've done, helping the miners feel good about themselves, raise confidence and self-esteem, and improve their health, mental health and physical health as well. So we did a photo shoot, we've done community talks, training for staff in various organisations, artworks, exhibitions, we've supported a kind of a sculptural artwork in Doncaster, and posters we've created, again showing the kind of work people do in former industrial work, and things that we use these images to educate school children about the environment, about what the landscape used to look like, and how they can also help to make a difference regarding air quality. And a few more posters there, young people involved there. And the main question we ask them is, how can communities improve air quality? What can they do? So we get people talking by attending various events all over the country, such as this is this is the Durham Miners Gala. Every year in July, we go up to Durham and meet communities and talk to them about health, get well-being and so forth. So and it's about, yeah, making our voices heard. Today is all about that, getting our voices heard. And just a few resources. If people want to find out a bit more, we share some of the resources, brilliant resources that are online and websites that are available, loads of resources people can download. So that's the end of my slideshow. So I will bring in Malcolm White next, who will share his story, backstory and experience and some of his knowledge around clean air. So I'll just stop sharing my screen and add Malcolm's PowerPoint. Let's see if we can find it. 1 second, it's here.
Great. And just while you're bringing that up, Norma, I'd say
Yes.
thank you very much for having me come to speak today. My name is Dr. Malcolm White, and I work with Global Action Plan. We're a charity that aim to mobilize action on the systems that harm us and the planet. Yeah, and so we run Clean Air Day, which is the UK's biggest day in the year in the fight against air pollution. And so we're delighted to attend events like this that are running on actually Clean Air Day itself. So yeah, there are hundreds of events going on up and down the country, both online and in physical spaces. And so it's been great, because I'm also just attending a conference that we're helping organize, for example, today too, down in London, relating to the healthcare sector. My background is in hospital medicine. And so I did about 10 years of working in that. Still go back and do the odd shift, but mostly I work in the air pollution space now. Yeah, a lot of these times, a lot of what I do with Global Action Plan is in delivering training to healthcare professionals in terms of how they can speak to their patients about air pollution. And so that's why these slides are labeled as such. And recently we did a project down in Southampton, for example, so that's where this comes in. And I mean, it's a fascinating talk to hear about the story of the Windrush generation and how you know, they worked in the mine for so many years, and the impact that had on all of these people, and the unknown way in which they provided this help to society. So it's great that that is gaining the recognition it deserves. And it's interesting how, as gradually we've moved away from coal, which I will say thankfully, because although it was a form of employment for so many people and a big part of our society, of course, it's a pretty dirty fuel, really, and it is, you know, collectively we're wanting to move away from burning of fossil fuels over time. So although we see that air quality in the UK is sort of a success story in the sense of we burn much less coal, and gradually engines are cleaner and all sorts of things like that, there's still a lot more work to do. And it is very true that air pollution does impact us all. And this is unfortunately from before we're born even, because air pollution can impact pregnant mothers and cross into the baby. So it's before we're born through until old age. And there are many types of air pollution, and I'll go into a few of those as well. As I said, today is Clean Air Day. So that's happy Clean Air Day to us all. It's the biggest day in the year in the fight against air pollution. And I'll speak a little bit about sort of the bigger international context, and then maybe bring it down to the UK a little bit as well. Fine. And so it's even just looking at one type of air pollution here called particulate matter, which just means tiny, tiny little particles or droplets of liquid or anything like that that float around in the air because of the activities that we do, like burning things and sprays and all sorts of things like that. So they float around in the air around us. And unfortunately, the vast majority of the world's population live in areas where the air pollution is too high, you know, in a level that we would consider unsafe. And that's referencing the World Health Organization, who lead in this space. And we can sort of think about the impact that that has to the population. And so these figures are very much averaged out across the whole world. So if you take everyone in the world and you think about the amount of air pollution that they are exposed to on average, then for the average person, it reduces their life expectancy by over 2 years. And that's, there are some countries in the world where this is much worse, and there are some countries in the world where this is better. And the UK is sort of, somewhere in the middle, I think, when it comes to all of that. So as we'll say, by looking at this next slide, however, with the countries that unfortunately have the worst levels of air pollution, and there are a lot of reasons for that, but with Bangladesh, you're talking at nearly 7 years of life that the average person there loses as a consequence of air pollution. And there are many reasons, like, for example, Bangladesh has a very dense urban population in a lot of areas, and they do a lot of burning, and unfortunately a lot of the sort of government policies and things like that are not as advanced in the same way when it comes to dealing with this. So vehicles will be dirtier, there'll be more burning inside buildings and cooking and all sorts of standards, essentially, that it's taken a very long time for us to get in the UK. And if we compare that to the UK, then the situation is better, but unfortunately, we still know that air pollution is a significant issue in the UK. And it still means that the average person still uses like months of their life as a consequence of air pollution. And so there will be some people who lose more and some people who lose less. And how that sort of translates into the average year in the UK is that it has a really, really big impact. It causes, up to 43,000 people dying each year, which has a really, really big impact as well in terms of general sickness that happens in the country as well. So people have sick days as a consequence of air pollution, and that has a really big financial impact on the NHS and care as well as putting just a great amount of strain on the NHS as well, so that the front line really feels it when air pollution levels are high. But also it's the long-term exposure, which means that people are much more likely to suffer things like cardiovascular illness, like heart attacks and strokes and things like that, which is actually, it's heart attacks and strokes which are the main driver and the main way in which air pollution causes death and illness in our communities. And I'm not going to go into all the details of this slide. It's a very almost bewildering, complex slide, but essentially it looks into different types of air pollution. We've talked about particulate matter, those tiny little droplets or particles, and then nitrogen oxides are mostly related to when you burn things. And so actually the biggest source of that in the UK is related to road transport because of internal combustion engines. With particulate matter, as we've moved away from using so much in the way of, say, industrial coal burning, or a lot of industrial processes have moved out of the UK and things like that, then actually the biggest contributor to that in the UK is stoves and wood burning stoves and other open fires and things like that. And it's one of the few areas in which air pollution is actually growing, whereas most other causes of air pollution have continued to slowly decrease over time in the UK. Sulfur dioxide, I won't go into too much, but it's often associated with coal burning and indeed a lot of industrial processes, including the creation of energy by burning things like gas. And then ammonia, NH3, is the vast majority of which is created in relation to farming. And so that's, say, the manure and dung and urine that comes from animals and livestock, and also artificial fertilizers. So although people generally are quite aware that that impacts on the waterways, it is actually quite a big contributor to air pollution as well. And then lastly, now what here is labeled NMVOC just means non-methane volatile organic compounds. Essentially what that means is that there's a list of about 10,000 or so chemicals which are all used in human processes, and there are many, many examples of what they are, but unfortunately they are known to be harmful to human health. And so you can get a lot of those from industrial processes, but as we'll see in the indoor space in the next slide, there's a lot of places in which these VOCs are harmful to human health, and there are many sources of them too. Fine, and so when we're looking at this indoor space, I'll just mention VOCs again, because that links the two slides. But many examples for things like, say, fire retardants, things that you spray onto furniture to stop them burning, and carpets, other things like that, things like hairsprays, perfumes, polishes, etc., etc. To be honest, if you can get a smell of it, then, you know, it's therefore it's chemicals which are pretty much unnecessary in the air, and then therefore you can actually appreciate that they're probably going to be harmful to you. So that might not be a complete hard and fast rule, but it's one I sort of would stick my finger in the air and say that it's usually a good way to appreciate when things might be doing you some harm. Fine, and then another big one to talk about as well is relating to mold and dampness in the home. And this is one of the areas in which we can really appreciate that air pollution is not an equal impact for everyone in society. So there are many people in the UK who come from poorer households, are more socially, economically deprived, and this particularly impacts people of different ethnic background than, for example, the white majority. Because a lot of those people live in poorer housing, and often that can be because they live in the private sector of housing, or they live in, say, council or other other housing that the individual does not own, and that can often mean that they don't necessarily have the power or the financial means in order to change their situation. So if they've got damp in the home and they need to ask permission to change it, then they also need to convince someone that they're going to spend the money to change it. And that often is why there are such tragic cases of people dying essentially as a consequence of air pollution. Fine, so it's a serious issue, but in terms of, and this image here just demonstrating what sort of size we're talking about in terms of particulate matter. But I think what I'd really like to come on to, other than just saying here, this general trend of air pollution slowly coming down over time, was some of the ways in which we can sort of reduce our exposure to air pollution and reduce the amount that we're creating, before we then hear a bit more about, say, filtration and monitoring and other measurements and things like that too. So I'll probably skip past to a couple of those. This just looking at a map of Hackney, in which you can see that the roads are the areas where the very high levels of air pollution are shown. And this one is the nitrogen dioxide, which, as I say, is related to cars and vehicles a lot, with burning fossil fuels. And indeed, as I said, some of these slides I wasn't immediately going to be bringing in. But once the air pollution gets into the lungs, then it crosses into the blood and it travels around the whole body. And that's partly why we see so many health conditions which are associated with it. But enough about some of the harms. I'd like to get on to how we bring this to the population. And so a lot of the work I do is about speaking to health professionals so that they can pass this information on to their patients about the risks and the harms, and then we consider about what the actual steps that people can take in order to make better changes and better behavior changes too. It's definitely worth recognizing that a lot of the changes that will help bring about improved air quality over time have come from things like legislation or government policy. So it does require that really, really big consideration and the big changes in society in order to bring this. But it is still definitely fair to say that there are things that the individual can do in order to reduce their exposure to air pollution and to reduce the amount that we are creating as well. And so this is just from one of our leaflets that we have at Global Action Plan, where we're aiming to pass this information on to our patients. And indeed, a lot of the choices are grouped either into outdoor air or outdoor air pollution on the left-hand side, and on the right-hand side, it's changes that we can make inside the home or office or school, etc. And so a lot of the outdoor air pollution choices have to do with reducing our dependence on vehicles as much as possible, which either means using public transport when available and suitable, and then also from improving active travel infrastructure and improving the amount that we either walk, wheel, or cycle, etc. So by doing that, we improve, it has lots of other benefits like improving physical fitness, and often costs less money, all sorts of benefits. So if we can be convincing people in this direction, then we're onto a good thing. And you could obviously go and speak on about this a lot more, but just given the interest of time, I'll move on. When it comes to things inside the home, we're often wanting to think about reducing the amount of air pollution that's being created in the first place. And we're not saying that people shouldn't cook or use their gas stoves or anything like that. We need to understand the context in which the person lives. And again, if they don't have the money or the power to change their gas cooker, then there's not very much that we can do in that situation other than give them general advice, which is maybe while they're cooking, and then this is with an oven or with gas, etc., that they can be opening the windows. Because this helps ventilate the space and it reduces the amount of air pollution that someone is being exposed to. Indeed, this is true in general, that we should be trying to reduce burning as much as possible, and that includes smoking and stoves, etc., etc. And then another example is that if you're doing decorating, trying to use products that are labeled low VOC, which most big manufacturers are now moving in this direction anyway, which is great news, but it is still possible to find ones which are a bit more harmful. And once you've done that painting, trying to ventilate the space as much as you can for a while is great. And so in general, that is the case, that we're trying to reduce the amount of air pollution that is there in the home, but accepting that there is going to be some, and that's just because of the activities that we normally do. We then think about how to either ventilate the space or indeed look at things that might be like filtrating out some of those air pollutants too. And another example can be, you've got someone who lives in a high-rise flat, in a moldy high-rise flat, so they've got air pollution inside the home, and they might be living beside a motorway, so that they've got air pollution quite bad outside their home too. So in that sense, they're in a rock and a hard place situation. And when you're speaking to that patient, it's kind of trying to find the balance. It's trying to recognize that it is a difficult situation, but it might be that they can open the windows while they're cleaning. If they're not doing it during the rush hour, for example, then they're reducing the amount of air pollution coming in while still allowing the indoor air pollution to go out. Anyway, lots more could be said about that too. And I'll just leave this as my sort of takeaway message at the moment, is that air pollution does seriously impact all of our health. There are loads of different types of air pollution, and I don't think we all need to be experts on knowing exactly what they all are, but just trying to do our best to reduce the amount by reducing our contributions is a big step. But there are also things we can do to reduce our exposure to the air pollution, which is just naturally around us as well. So yeah, I think in the interest of time, I'll probably stop there, Norma, but I'll hand over back to you.
Great stuff. Thank you, Dr. White, for sharing that brilliant knowledge with us. We will be joined now by Graham Thomas, the CEO of Medicare, to share some of his knowledge and expertise with us from this moment. I think hopefully he'll have a PowerPoint. Brilliant.
Yeah, hopefully that has come up now for you.
Thank you. Well
Excellent.
done.
So I'm Graham Thomas. I'm the COO at Medicare. We are a air purification company, but my background is actually around 20 years in local government and central government, working on public health and air quality and environmental health. So that's very much my background, is coming at this from the health perspective. I'm sure Malcolm will be very pleased to hear that during my stints, I have done many clean air days out in the towns, talking to people about predominantly outdoor air pollution. So with Medicare, our main focus really is looking at the issues associated with indoor air quality. So many of us will associate air quality with scenes like these relating to outdoor air quality. So we've got the London smogs, where much of our outdoor air quality legislation has come from to prevent that from happening. And as Malcolm's already talked about, there's been great strides made towards improving outdoor air quality and preventing scenes like that again. But again, still so much more that can be done. And I'd say it's very much been highlighted by different groups taking action against our own government, relating to outdoor air quality, and that's very much brought that to the fore. But when we look much more closely, the picture at the bottom right is New York last year during the forest fires. Is that arguments can be made whether that is man-made pollution or not, but ultimately that is affecting huge populations. And I think what we need to remember is things like forest fires are happening across Europe, and that there's huge forest fires happening across kind of Canada and North America, for quite large quantities of the year. And then the bottom left, we've got again Delhi, not too long ago, where smog predominantly from traffic and industrial processes is causing an issue. But what we often think, certainly within the UK, is that we walk into our homes, we close the door behind us, and many of us think that we are in a safe space, that dirty air is outside, and that we're in our house, so we're fine now. And I think there are so many things indoors that present issues to us, and that in kind of Western society, and certainly when you look at the UK with the way our weather is, and that's sort of very appropriate at the moment, is that we spend significant proportions of our time inside. And as Malcolm's already discussed, there is that air pollution that's being created from things like industrial processes, from roads, that is seeping into our houses, whether we have windows open, when we open doors, through air bricks, kind of that natural ventilation that's built into many of our properties, actually allows the stuff outside to penetrate in. But that we also have that generation of contaminants inside. And as I've kind of got on the list there, VOCs is a it's a huge list of things that are inherently bad for us in the tiniest of quantities, most of them. But we also have things like the combustion issues. So when we have our boilers on, we've got things like carbon monoxide, we have got the nitrogen dioxides, we've got things like particulates, unpleasant, but things like it's the skin and all of these kind of things that are floating around in the space as well, through to more kind of dangerous things that like asbestos, or when I say more dangerous, people consider and perceive as a more dangerous risk to their health because of the known health cases around things like that. But what we're also seeing an increasing amount of in relation to indoor is things like allergens, is the pollens, the dusts, through to even things like milk powders and things like that, where people have intolerances. But also, again, things like those microbial issues from bacteria, from spores, from your mold, which is again, it's about educating people that the mold on the wall isn't necessarily the issue. It's the spores that it's throwing out into the air that you are breathing in is what is making you poorly. So, kind of, again, we're obviously on a similar mindset to try and, say trying to describe how small these things are in the air, that it is very much that invisible issue that is it's very difficult to see, because if somebody gave you a glass of dirty water, you would wonder what on earth was wrong with them, because you can see that, but you can't see that same issue necessarily so much in the air. And so, yeah, in terms of looking at the issues relating to indoors, mold is a really big issue. We're currently working on a project with several other partners where we're working with a social housing company, looking at actually how we can try and help with regards to those mold issues in properties, whether that be, you know, as a stopgap to try and deal with the underlying issue that's causing the dampness, or whether that, you know, kind of be a longer term solution. As I say, things like allergens, we've got lots of people talking about dust mites and the issues related to those in terms of things like skin conditions, but also breathing conditions. Yeah, bacteria again. You know, we've got all of these things floating around that, you know, like to cause us to become unwell. And one of the things that perhaps people are less aware of, although, you know, research and literature is growing across the UK, is around something that's termed sick building syndrome, where people suffer from a variety of different health effects that seem to be related to spending time in a particular building, as opposed to having a specific diagnosable illness. So that's where we'll look at things like irritation of eyes, nose, throat, fatigue, nausea, irritability. So these are all things that people are experiencing in their own homes, but also in their workplaces. And as I say, you know, there's also a significant number of building related illnesses that are diagnosable, that are caused by and exacerbated by poor indoor air quality. So as Norma, you've already mentioned the issues around asthma, that actually, you know, the poor outdoor air quality is a significant trigger to a lot of people, but likewise it's the same in terms of coming into offices and other buildings where you're going to be, that if you are in a big city, you are often going to have a building-wide heating and ventilation scheme, which means that you inevitably will have the big fans somewhere located somewhere on the building that are sucking air into the building and then pumping that round the building. Now, if those fans are located on the road side of the building, you're going to be getting all of that pollution being sucked in and blown around the building, which you know, obviously presents issues to lots of people, and that's where these kind of things are coming from. So where Medicare comes in is that we look at trying to remove these contaminants from the air, and so we use a mix of different technologies that have been around for a significant period of time, are truly tested, but what we've done is we have combined them. So we use a HEPA filter now. HEPA filters have been around for donkey's years, but these come in a variety of different levels, different grades. So what we use is a HEPA 13 or a HEPA 14 filter, which means that you are looking at either 99.97 or 99.995% of all particles at a 0.3 micron size being removed. So if I go back to this picture, we're talking about 2.5 being a significant issue. When we get down to 0.3, that is one of the harder sizes of particle to remove from the air, hence the reason that the testing for the HEPA grade is done at that. But you can see how small that size is. So we utilize HEPA. We use activated carbon. Now, activated carbon is for those kind of gaseous pollutants, and many of those are, you know, as Malcolm mentioned, the things that smell in the air. So the activated carbon in our air purifiers is there to remove those VOCs, which are the vast majority are classed as carcinogenic, so cancer causing. And then what we also utilize is UVC for dealing with viruses and bacteria, which again has been you know, a significant issue during sort of the COVID period that we've experienced with viruses. But again, we are seeing resurgences of other airborne spreads, diseases such as measles and tuberculosis and things like that becoming again more prevalent in the news. So again, these are still issues. So what we have done is ultimately combine these technologies in order to give the best kind of air cleaning solution that we can. Now, in terms of talking about air purifiers, there are hundreds available on the market, and I think what I'm keen to do is try and educate people on how to best select an air purifier, because as I say, there are lots out there. There are lots that make all sorts of claims. There are several that were fined by the Advertising Standards Agency because of what they were saying during the COVID period. When selecting an air purifier, yes, some of it is going to be budget, but what you need to do is try and buy the best that you can within your budget. So you need to look at companies that have done testing on their air purifiers. So, for instance, we have testing not only on you know, to determine the HEPA standard, but we also have testing on viruses, on bacteria, on pollen, on all of the formaldehyde, all of these different kind of bits and pieces that we have laboratory testing that we have available on our website for people to see that we've had it tested and it does what we say it will do. But then what we also have as well is we have real world case studies where we have case studies where our units are being used in working schools, in office spaces, in museums, in sports facilities. You know, I think that for us, laboratory testing is good to make sure that, you know, it does what it says on the tin. But in reality, what people really care about is, does it work in the real world? You know, hence why I mentioned earlier that we're working with partners and a social housing company on the issues that they're facing with mold. So you know, I think it's really important to make sure that, you know, you can satisfy yourself that what you're buying is going to do what you need it to do. And I'm saying that on the basis of significant experience here at Medicare of the number of people that come to us going, I have tried 2, 3, 4 different air purifiers and it has made no difference to me. Aside from making sure that it works, what you then also need to be making sure is that you are purchasing something that is going to deal with the space, the size of space that you want it to work in. So the World Health Organization recommends 10 air changes per hour in kind of medical spaces, and in non-medical spaces, so things like your school classrooms, in your home, in offices, is 5 air changes per hour. What I mean by that is that we are looking at the volume of air in the space. So you have your room, you have the length of it, the width of it, height of it, and from that you can work out what the cubic meterage of space is that you have. So if you have a room that is 30 cubic meters of size, it's obviously a smaller bedroom, but that is, that's your bedroom space. Okay, what you really need then is you need an air purifier that can do at least 150 cubic meters of air per hour in terms of cleaning it to achieve your 5 air changes. So it's all well and good buying a really good air purifier, but if you then expect it to do a space that's 4 times the size, it's not going to have the same impact as what you're looking for. So again, I don't want to make this too salesy in terms of Medicare, but we do offer different size units, again, to cover those different size spaces. So our Medicare Pro Mini is our smaller unit, and that has become predominantly or very recently has become very popular in homes. So people using them a lot for issues relating to mold, to allergies, that they live in a bigger city, they live near a main road, and therefore they need to look at a method of cleaning their air, through to our kind of pro unit that is our big one in healthcare spaces that the NHS use, and that the World Health Organization and other people like that use. And then our Pro Max is for those big spaces, like a big school hall, or for open plan offices. So that's
So
kind of
Graham,
yes.
So Graham, sorry, just go back to that slide. So for instance, in the home, a family, a terraced house, say, would one be enough for somebody's home, like a terraced home with 2 bedrooms, living room? How many of the Medicare Pro Mini would you need? Would one be enough, or would it be like 1 in each room? How does that work in the home?
Yeah, so although it will have an impact across rooms and across the living space, it's going to have that best impact in a single room. The advantage that you have with something like the reason that the Pro Mini is so popular in homes is because it's light enough for you to be able to carry around the home with you. So we have we have people who are on a tight budget, and therefore they will purchase one, and they'll use it in their bedroom for when they're sleeping. They'll use it in their living room for when they're in that space. They'll use it in their kitchen when they're in that space.
Yeah.
Ultimately we do deal with other clients who not that money isn't an object, but where they are able to put units, multiple units across their home. So it's as I say, it will have an impact across the space, but really you'd be looking at the space that you're in is what it's going to be protecting.
Thank you.
So this is really just to give a bit of an idea of the people that we work with, but also the variety of spaces that we work in, and that this is an important issue in not just healthcare spaces, but in people's homes, through to TV studios, recording studios with Universal, through to dentists and dental surgeries, through to office spaces, through to oil rigs on the North Sea, through to Premiership sports stars, and that air quality has different impacts across all of those spaces, and that people want to improve the indoor air quality for a variety of reasons. So in healthcare, it's often around infection prevention control, so reducing outbreak of airborne diseases. So things like reducing the chance of things like COVID spreading, measles, tuberculosis, and sort of bacterial infections as well, through to office spaces. It's about improving the space for your employees, but also there's a bit of a return on investment there by reducing sick days, reducing, you know, lethargy and that inefficiency in your mind because of the issues that your body is subjected to, through to elite performance sport where you know, we are looking at marginal gains to make those improvements. I mean, we can't take all of the credit, but if you look at Northampton Saints, they have won the Premiership this year, and you know, we started working with them about 18 months ago. So you know, they have seen a significant improvement in performance through that, and that is, again, that is about improving the space in which they're able to do their physical preparation. So in the gym space, improving the air, that's allowing to improve themselves, improve physically. It's used in the spaces where they are doing their team meetings and things like that, because again, there's that ability to focus for longer and take that information in, and also, you know, from that reducing sickness side of things. You know, a lot of these big sports clubs, they allow, don't even allow, they do stadium tours. So, you know, you've potentially got members of the public who may have coughs, colds, sneezes in the changing rooms 20 minutes before the players are coming in, and they're then being exposed to those viruses and those bacteria that are in the air from outside sources. So there's a lot of reasons why people want to improve their indoor air quality, and you know, there's a lot of things in indoor air that can create issues for you and your health. Yeah. So I mean, that's sort of the end of my presentation anyway.
Thank you, Graham. Well done. So how can people purchase one of your air purifying systems? How can they get hold of them or test them?
Well, yeah, so you can come onto our website, which is medicare.co. We're also available on Amazon as well. We're also working with a couple of high street retailers at the moment to look at you know, them becoming more visible on the high street and through other high street retailers as well.
Yeah, fantastic. So so just finally, just to sum up, I mean, what would we say are our key takeaways for the public from today's session learning workshop, this Clean Air Day 2024, raising awareness about clean air? What top five things that we could suggest that people should do?
Well, I think people need to sort of consider their own actions in terms of, like Malcolm's talked about, the generation of these pollutants. Are there things that you can do to reduce you know, pollution creation outdoors, but also like he's shown, reducing the pollution creation indoors? So I think there's that people perhaps need to step back and consider what they can do, and it really is that every little bit does make a difference. Is that, you know, I appreciate that, you know, it'd be easy to say, oh well, just go and get yourself an electric car. That's not something that's viable for everybody. So I think there's that, you know, consider what you can do. Perhaps, you know, take a few minutes to try and educate yourself a little bit on what, you know, like what we're doing here, what the dangers are, and actually, you know, are there things that you know, actually they can take a look and go, well, actually, and I've been really nasally at work, and you know, well, actually, maybe there's an issue there, and I think that sort of leads on to the next point about talking about it, because you know, air quality isn't necessarily a really popular subject that's talked about, yet it is so important when you look at so many of the other things that go into our body are regulated. When you look at, there's regulation on water, there are food regulations, but then when you come to air, which is something that we really have no choice about it, you know, we have to breathe. So, you know, is that perhaps, you know, there needs to be that discussion around air quality. And I think, like you alluded to, almost really right at the start of this, is that there needs to perhaps be a bit more push on our political masters to start to consider not just outdoor air quality, which there are already standards for. Again, whether those standards are where they need to be, whether enough is being done by the government in order to help try and get people to reduce that.
Yeah.
Are questions that I'm throwing out there, not statements.
No, yes.
And you know, likewise, that you know, given how much time people spend in the indoor space, is do we need to consider guidelines, limit levels, etc., for different things in indoor air? Again, I think it's again, I'm not saying that's an easy one, because again, with the delicate financial situation in the country for both companies and for people at home, is that suddenly saying, well, if your air quality is not good enough, you've got to do X, Y, and Z, and it's going to cost this, is difficult. Again, whether there's that opportunity then to look at some sort of funding. You know, during the COVID period, lots of European countries and places like the USA, funding was available for predominantly kind of schools and public spaces, and you know, so things like libraries and things like that, to be able to get funding to improve their indoor air quality. So, you know, I think that's probably more than 5 things, but I think really a lot of it is around trying to give people enough information to pique their interest, to find out more about it, to talk about it, and try and pressure the people that have the ability to do something about it to do so. I think that I'll condense it down to 3. So
yeah, that's brilliant. No, and finally, what are your hopes and dreams for the next 5 years or 10 years? What do you really hope would happen around clean air across the world, the bigger picture of the world? What do you wish for?
Yeah, well, I mean, there is more and more research being done around indoor and outdoor air quality, and I suppose the thing for me is that hopefully people's awareness is there, because I think once people have got the awareness of what the issues are, what the impact is, and I mean, I think, you know, there's, given Clean Air Day, there's quite a few different bits and pieces coming out in the news and the media today, and that one of those is that, you know, in reality, air quality and illness from air quality is now probably one of the leading issues for health, not just in the UK but globally. And you know, I think therefore it's paramount that we educate ourselves about it, that people become aware of it, because only then will we start to be able to look to take some sort of meaningful action. And air doesn't just stop at a boundary, you know. Air and pollution, they don't just go, oh, well, you know, we're in the UK, we're not going out the UK now. It's transborder. So you know, we can do all the things that we can in the UK, but that doesn't mean that we won't get pollution coming from you know from other countries.
Yes, thank you. So we're going to draw our presentation to a close today, and say a massive thank you to our special guest speakers, Graham Thomas from Medicare, and please go on, visit their website and see the amazing products and information, all the research that they have made public on their website. And to Dr. Malcolm White, who spoke earlier, please visit their website again, Global Action Plan, and all the brilliant resources, schools resources that they have online, a lot of social media kind of pictures and posters you can share. So they've got some amazing resources. If you want to find out more about the mining history, that the Black Miners Museum that I've been a founder of, and Nottingham News Centre, the educational resources we make, please visit our websites at blackcoalminers.com and nottinghamnewscentre.com. If you want to find out a bit more about my work over the years, please visit my website at normagregory.com. So thank you all, and we hope you will share with us next time. Thank you.
Thanks, Norma.